Okay, our speaker today is Emily Shields. She serves as the Chief Strategy Officer for OSF HealthCare, and she's responsible for leading the development, communication, and execution of strategic initiatives that drive growth, innovation, and long-term success for the organization. Reporting to her are leaders overseeing business development, marketing and communications, and planning. She also plays a key role in advancing the OSF Healthcare brand and shaping growth strategies that support the system's mission and future vision. Ms. Shields has been with OSF Healthcare since 2010, when she joined the organization as a physician recruiter. She has since held several leadership roles, including Vice President of Business Development. Throughout her career, Ms. Shields has been instrumental in developing partnerships and managing the integration processes to ensure seamless transitions into the OSF healthcare system. Ms. Shields holds a Bachelor's of Science degree in Business Administration and Marketing from the University of Illinois at Urbana-Champaign. She has been recognized as a Rising Star, 67 Leaders Under 40 by Becker's Hospital Review in 2023, and was named one of Peoria Magazine and WCBU's 40 Leaders Under 40 in 2021.
I don't think I'll ever get used to really formal introductions like that. And I am no longer under 40. Those words were from a couple of years ago. Good to be with you all today. I have been with OSF for 15 years and actually started my career working in the old Case Merchandise building just down the street, and would periodically come to Rotary when I was working out here. And is my presentation getting pulled up? Okay, perfect, thank you. So I'm just going to share a little bit about OSF, kind of what we're up to, and the things we have planned for future development, and also just a little bit about us in general. We always start with our sisters. They are really the foundation of our mission, and even from a structure standpoint, they are our board of directors. So we are really blessed to work for an organization that puts our mission at the forefront of everything we do, and that's to care for everyone who comes to us with the greatest care and love. And that's, regardless of their ability to pay, whether, someone has health insurance or not. All of us are so pleased and just thankful that we care for all persons that come to us, and we make all decisions with that at the center of what we do. Okay, thanks. So just to give a little bit about the scope, when we are all here in the Peoria area and may or may not realize that OSF is actually 17 hospitals across the state of Illinois, and then one in the Upper Peninsula of Michigan. Everyone always asks how that happened, and that was actually a call back in the day from bishop to bishop to say we really need some help serving the sick and the poor in our community. And so the sisters from here sent a few sisters up to Escanaba, Michigan, established a hospital, and the rest is history. So I just really appreciate those types of stories and know that our commitment, when they make a commitment to a community to serve that community with healthcare, that's a lasting decision. And so we actually, in 2027, will be celebrating 150 years of the sisters being established here in Peoria. So really excited. We are in the midst already of planning celebrations for the year, but just our commitment to Peoria and to the communities that we serve is really is lasting. But just to give an idea, on that slide too, we are now 27,000 mission partners across those 17 hospitals. We say mission partners instead of employee, so we really do feel that every person that works for OSF shares in our mission and is a partner in delivering that care to our patients. But across all of those locations, we serve over 1 million patients, and then this year are looking at about 1,400 between physicians and APNs and PAs of providers serving our communities. We're a really comprehensive network though, so we are more than just hospitals. We have a variety of primary care practices, specialty practices. We provide care at home. We have home care services, And a lot of the supportive services as well, like aviation, our Life Flight program has had a busier year than we ever have and provides support across the whole state of Illinois for those services. But hopefully you have interacted with us in some manner across the continuum of care. And we'll speak a little bit later in the presentation about the first icon you see there at the bottom, which is the For Sure growing, and that's our digital health and the way that we're serving our patients virtually, doing a lot of really cool things to be innovative in healthcare. And so with that, kind of transitioning to, we're really proud to be recognized as a company in these areas, and these are not awards that we applied for. They are independently selected, but to be one of the best in-state employers in Illinois, and then also to be named by Fortune as one of America's most innovative companies. That one, especially to be really proud of the investment that we've made here and the things that we're doing within healthcare to be more innovative. Because I'll speak in a little while about some of the headwinds we have that the entire healthcare industry is facing. Our other colleagues within Peoria, at Carl and other healthcare institutions, we're all experiencing a lot of the same challenges right now. So it's truly going to take all of us to continue to deliver healthcare in an efficient way and in a way that we meet patients where they are within their healthcare journey. So just talk through a couple of the industry realities. I'm going to build this whole slide. First, kind of shifting public opinion. It's been a bit of a hard year for healthcare when you think about how we started the year with some of the disruption within the insurance space. And we have, where I think in COVID, healthcare really was kind of superheroes, right? We were providing all of this care and kind of entering a more difficult year as we really are challenged with a lot of economic pressures. And I think our patients, all of us are challenged, right? You walk into the grocery store and the cost of milk and eggs is higher. Well, the same is true for all of us as we're delivering healthcare. That you see our revenues on the slide before and you think, oh, that's, you're a $4.5 billion organization. Well, it's costing us about almost that much to deliver healthcare as well. The cost of everything has been rising, but especially the cost of labor and the cost of pharmaceuticals, so the cost of medications and drugs that we have to supply to our patients. So, the political environment we're in now, I would be remiss to not talk about the government shutdown that we're in now, and there's some really direct impacts to us. As I talk about our digital health on the slide before, through the government shutdown, some of those services have to be wound down because they're attached to a waiver that's part of the bill. And so we just have a lot of uncertainty. There's a lot of changes to how we are paid by the government for delivering healthcare services to Medicare and Medicaid. And, that funding will be decreasing over the next several years. So we really have to come together and build our strategies around delivering care in the most efficient way possible, but still wanting to provide that really great care to our patients. So we've done a lot. OSF has invested a tremendous amount in our workforce and talent. Really proud of our program here in the Peoria area, where anyone who works for OSF, part-time or full-time, can apply to go to our College of Nursing for free. So if you weren't aware of that, tell your friends, tell anyone you know that you can even just work part-time at OSF and apply, and at absolutely zero cost can go to our College of Nursing for free. But that has tremendously opened a pipeline of students for us. We know we have to build our own because across the nation, especially for doctors and nurses, there's a shortage. So if you want to talk at all afterwards, let me know. I'd be happy to connect you with someone. Excited to hear you're interested in healthcare. This is a really confusing slide, and it's meant to be confusing. I'm going to simplify it to just kind of a couple overarching comments. And that is, within the healthcare industry right now, we are seeing massive centralization of services and decentralization of services. And that is all happening at the same time. What I mean by that is The decentralization of services is that more and more is done in an outpatient setting. So, a lot of procedures that maybe you used to have to stay in the hospital, not just for the procedure, but even, overnight for a day or two, like a knee replacement or a hip replacement, as an example. Those are now being done on the outpatient. The patient goes home a number of hours later instead of having to stay in the hospital. So we are seeing that shift of services. And then also, as I said, healthcare is getting more expensive to deliver. So what we're seeing is that you can't, afford to do something that's really complex, like a heart transplant there, right? That's at like the top end of the spectrum. But to have a heart transplant program here in Peoria, and then for OSF to also have a heart transplant program 45 minutes away at our hospital in Bloomington. So what you're seeing is for those really, really complex surgeries or procedures, those are being centralized to the larger facilities. But to make room for that, like in the Peoria area, that's where that decentralization is occurring. So we have to take out of the hospital things that don't absolutely have to be done there, but bringing into the hospital those more complex procedures. So that's what this graph is ultimately depicting, that there's all of this shuffle going on where services are delivered, but some of it's really great for us as patients too. If you've gone to one of our on-call urgent cares, it is such a great patient experience. They are open every single day, 8 to 8. As a mom of 3 kids, I cannot tell you how wonderful that is, and it's a very different experience than what I remember as a kid. Having to go to the emergency department or the hospital for something really simple that could have been cared for on an outpatient basis. So I think the good news in here is that we're providing more and more access points in new and different ways to our patients. I'll also give a plug to like our virtual urgent care. If you've never used it, you have, a kid with pink eye, or if I have gotten pink eye before, you can, take a picture of what's wrong with you, fill out a short questionnaire, and you text or have a video visit, and from the comfort of your own home, you can have your, medicine called into your pharmacy and delivered. So it's I don't need to be a commercial, but I just say there's a lot of really great things that are coming from this shifting in the healthcare industry as well. So there's my talking points that I just said. So really, as OSF looks to our future, we've been on this journey of really growing as a system, of making a commitment to innovation. We have the JUMP Simulation and Education Center that's downtown on the hospital campus. It's a physical building where we invest in education and simulation experiences for training our clinicians. But as we've been on this growth journey, you can see from 2007 until this year, the number of hospitals that we have grown by. We have been what I would call opportunistic in our growth strategy. We aren't going out there and saying, we want to acquire all these facilities. I think in almost every instance here, those facilities have come to us. These are smaller independent hospitals, or sometimes a grouping of hospitals that recognize for their sustainability to achieve that scale and deal with some of those economic and financial pressures I talked about before, that they want to join a larger system for that level of support. And so you can see we've grown and acquired a number of hospitals. Some outpatient physician practices have joined. So this is across the whole state of Illinois and also in Michigan, and just how much we've grown. But as we think about our future growth, there's kind of a limit to the amount of maybe size or scale you want to achieve. And we really recognize our place as what I classify like a regionally relevant healthcare system. And so while we've grown in breadth, I think it's time for us to invest further in growing in like the depth of our services that we're providing. So we're really focused on better access to that very complex care that I talked about is really being centralized across the industry. Doing that here in Peoria. And we really already have made this investment. If you're familiar with our Children's Hospital of Illinois, they currently do care for patients from all over the state. So we're really investing in the programming within oncology, so our Cancer Institute, neurology, our Illinois Neurological Institute, and cardiac care. So Currently we are caring for 1 in 4 patients. When you kind of look at the 41 county area, you kind of go from south of Chicago and north of St. Louis. That's kind of the chunk of the state that would be realistic to come to Peoria for care. We currently care for 1 in 4 patients from that area, and really so proud of that reach across the state that we currently have, and really believe this is our path for growth in the future to continue to invest. But what's really exciting for that, right, is that's investing for Peoria as a whole. So really, OSF has made a big commitment to Peoria. If you think about just a couple of years ago, moving our headquarters building downtown, and I really just see that continuing to grow in the future. I talked a little bit about innovation. We are really committed to innovation, and I'll highlight the Jump Trading Simulation and Education Center. And so that's really a great collaboration between ourselves and the University of Illinois College of Medicine. They have medical students, and then right after you complete medical school, you have a residency and then potentially a fellowship. And all of those students and residents are able to come to Jump Trading Simulation and Education Center for that training. And so we've recognized the value of having hands-on training to learn how to do things in that environment before going and doing those procedures, or learning to nursing students learning to place an IV. They can do that, and we have called high fidelity mannequins. They look like fake people, but they have tubes, in this arm, so you can actually that have fake blood going through them. So you can, so it feels like real things you're doing, and that makes them so much more effective when they go to perform that procedure on a patient for the first time. That's one very small example of the work being done here. And then we have our STEAM program. So we connect with local schools through this program and distribute kits. They're also available online. You can buy a shark dissection kit. It's a really cool gift for a kid if they're really interested in science. I've gotten them for my oldest before. But they also have internships available through this. And of the 19 interns that we had this past summer, 15 of them were from the Peoria area. So really, investing in our kids around here and providing any opportunity we can within OSF for their development. That was specifically about the kits. So you can see how many kits have been distributed in all these places across the United States, which I think is so cool. In addition to books and tons of outreach events, field trips come on site to Jump at least once a week from the schools around the area, and then we've definitely gone on site to other schools as well in a number of events. And then finally, to highlight some of our digital health services. So this is one of the fastest growing areas within OSF, and there's so much healthcare now that can be delivered virtually. And so OSF made an investment, and actually it was right before COVID hit that we formally, were putting the structure in place to stand up our digital health entity. And you can imagine what fortunate timing that was, that we had made that investment prior to COVID. And something that had probably a 5-year roadmap of getting services ramped up and ready to be delivered happened in a matter of months during COVID. But the great part was how much advancement we were able to make in a very short period of time for some of these services. I'll just pull out a couple of examples to highlight. I could do an entire presentation just on this, but one being what we call EICU. So if you or a loved one, would unfortunately end up in the intensive care throughout OSF HealthCare, in addition to that care team that's, at the bedside providing that care, we also have in one centralized location, a team of additional physicians and nurses that are monitoring that care from afar. So they're watching the vitals. They have cameras that they can camera into the room. And this is fantastic for those patients in our larger hospitals, of course, just to have that additional layer of support. But what it's really cool is one of our small rural hospitals in Kewanee, Illinois, for instance, or in Pontiac, Illinois, that they have a patient in that ICU, and for those teams that maybe don't care for that intensely, ill patient as often as maybe a larger hospital like Peoria or Bloomington or Rockford, that those teams have that physician and that nurse that with, a video call away to help them care for that patient, so that it really helps us provide the highest quality and standard care no matter which hospital across OSF you might end up in. And then we have some outpatient programs too. So if you go to your primary care physician and within certain programs, you are higher risk for an emergency department visit, or if you have multiple diagnoses like hypertension and diabetes together, we have what we call remote monitoring. So it's text-based solutions or phone calls. The patient can decide what works for them, but that we have a care team that's constantly checking in. So if you're a diabetic, right, you're putting your blood sugar into this text-based loop. And it's great that the patient is monitoring their own symptoms and being aware of that, but the secret sauce is, right, what's behind the text loop. So if there are symptoms that a patient is reporting that are concerning, we can escalate that immediately to a virtual visit and help get them an appointment to their primary care physician right away, or sometimes give them counsel. You need to go to the emergency room right away, but it's really providing that immediate care for patients and keeping them, the goal, right, is healthy and out of the hospital and appropriately managed at home or with their primary care doc. So really just, we really take pride in our mission. We take pride in serving our patients and in the Peoria community and the communities across our system. But I'm really excited for the growth that's going to continue to happen. And just thank you for your time. I'm happy to take questions as well.
Testing. So thank you so much for speaking to us today. I've learned a lot and very exciting for all of us in the care. About 6 years ago, my wife had an issue and we were at the Proctor emergency room for 5 hours. So my question to you, and on top of that, we were offered a fireman if we needed somebody, or EMT we were offered if we needed help at that moment. So my question is, what's your biggest shortage now, and what are you doing about it? Thank you.
That's a great question, and that is even surprising. Usually Proctor is the lightest emergency department to go to. It's emergency medicine is certainly challenged across the industry, but actually our number one shortage right now is urology. I don't know if anyone has tried to get into a urologist, not just at OSF, at Carl. It's incredibly challenging. And we kind of just had a perfect storm of a physician or two leaving, a couple of APNs that left and are going other places within OSF. And I'm saying some of this because letters went out to some of our urology patients. So if anyone wants to talk about that, I'm happy to speak afterwards. And the communication, perhaps could have been a little clearer, but what happened, right? You have a number of providers leaving, and we have new recruits, new physicians and APNs joining, but the recruitment cycle for physicians is so long, and we do have 2 new joining, but not until next summer. Nationally, though, there is a shortage of urologists, and it just takes a very long time to recruit. But what we've been investing in is more investment in clinical education, knowing and doing things like paying residents stipends. So while they are still completing their training, incentivizing them to come back and work for OSF, we are able to pay them, essentially a signing bonus, but to spread that out throughout their training so that we can support, with that commitment of employment following. So we're being as creative as we can, using things like, referral bonuses. So for anyone who works at OSF, if you help us successfully hire a physician, that we, can issue referral bonuses. We are really trying anything we possibly can, but urology is by far the most difficult right now, and it's a national shortage.
You never mentioned, or you may have, the new proton facility
Yes.
down by the hospital. I was there recently. It's a beautiful building. It's got waterfalls, whatever, but it's
Yes.
Nice, very nice place.
Thank you so much. If I went back to my slide where I had all of, the services, I mentioned the Cancer Institute, but not Proton specifically. So thank you for highlighting that. We're really proud of the Cancer Institute, and that continues to grow. We've hired our first medical oncologist to begin seeing patients there, and over the next year have I think 2 more joining in the next few months, and then next summer 3 more. So by this time next year, I think we'll have 6 medical oncologists. The really exciting thing is, yes, they will provide clinical care, but a large portion of their time is dedicated to research. So we are really investing in the research that's being done, and have a lot of investment also in our early detection programs. But specifically Proton, we are within Central Illinois, the only place to offer that. I think the only other one in Illinois is at Northwestern. And what that does is it really targets the radiation to be intense in a very small spot, so that overall, I'm really simplifying it and I'm not a clinician, but we can more effectively treat the cancer while delivering it with a lot less radiation, to put it in its simplest terms.
This is probably not a softball question. The problem in the United States isn't the medical care, it's insurance.
It is.
What can you tell us about where that's going?
And that's part of our challenge this year is they are very crafty in how they difficult they can make it, not right for the patients. And this is not like an oh poor us, because I can certainly appreciate as a consumer of healthcare how difficult it is to navigate. But even for healthcare systems, we have experienced the largest number of insurance denials over the past 18 months than we ever have before. And it's because they're using AI to do those insurance denials. And we kind of laugh. It's like the battle of the AI bots, because we've started using AI to file, you have to appeal those denials. And so we use AI now to appeal the denials. And it's like, it's going against, and we've made some progress. We really have over the last 18 months, but we were hit, I would say about 18 months ago, with more insurance denials than we have ever experienced before. And understand what that means for you all as patients. Like, you guys get caught in the middle of it, and in worst case scenario have situations where care has to be delayed while we're trying to figure that out. So I don't have an answer. It's hard for everyone. And I think that's part of when I talk about shifting public opinions, I'm always like, oh, I don't know how deep or far to go with some of my comments there, but that's precisely what I was talking about.
So one more question. How close are we to being operated on by a robotic arm?
I think we're very far, personally. I think we're very, very far. When I think about how OSF is utilizing AI within our clinical practice, it is to enhance what our physicians and our care teams are doing. So an example, if you've gone to an OSF provider recently, they may have asked for your consent to use their phone to transcribe. Thank you. Somebody said the word. It's called ambient listening, right? It's listening to what's around you and transcribing that into the medical record. So what it's taking is, if a patient is talking about chief complaints they have, or as the doctor might be dictating as they're doing the exam, and then that's populating the medical record for that physician. But the important part is it still requires that human review and sign off. So that part I don't see going away. And we're utilizing AI, right? Like I said on the back end, the example with insurance company denial, some of our other revenue cycle functions, really simple tasks that We really aren't seeing an impact to the number of employees that we have. It's more of we're able to utilize them to do higher level functions.
I don't have a question, it's just more of a comment, but I think that one of the only blessings that we did get out of COVID was that increased telehealth. So at Epic, something we've always asked for was more remote medical assistance, and we were always told no, no, no. And so for our people with disabilities, it's really been a game changer for people that are homebound or the service staff that are helping them with their medical needs.
Yes.
It's otherworldly for agencies like ours.
Oh, that's great to hear. Thank you.